I'm going to look at the danger of diazepam. What are the dangerous trap people go into because they're on diazepam medication? Now, before I go into the 4 dangers of diazepam and 4 ways of coming off it, let's talk about diazepam a little bit. As a pharmacist that gives out this medication every day, I want to tell you a little bit about diazepam. Now, diazepam, is what we call, it belongs to a class of medication we call benzodiazepines. And they are used for all sorts. Diazepam can be used as an anxiolytic. In other words, people are using it, doctors can prescribe it for release of anxiety. It's called anxiolytic. It can also be used for pain. It can also be used for insomnia, for people who are struggling with sleeping. And so these are the major reasons why your GP will prescribe it. Also, the question I want to ask you, which most people don't realize or they don't know about, is do you actually know how long you're meant to be on diazepam for? Ideally, you're meant to be on diazepam between 2 to 6 weeks. So about 2 weeks, maximum of 6 weeks. But I know people have been on this medication for a very long time. And so now the one thing I must have to confess is, before I carry on, this video is for those who have been hooked onto it and they want to pull back. There may be valid reasons people have to carry on using it for a very long time. So if you have a valid reason for using it for a very long time, I don't want you to stop it. I don't want you to feel guilty that you're using it, because really your life literally depends on them. But there are cases of where people go on it and they want to stop it, but they can't. And so this video is to tell you the dangers, 4 dangers of being on it, and 4 things or 4 ways you can do to stop it. Now, when you have stayed on diazepam for more than 6 weeks and into months, you develop dependency to them, and any attempt to stop suddenly will lead to what we call withdrawal side effects. So being on it for a long time, you don't want to be stopping on it so suddenly, because your body is, it's not an addiction, but there is a psychological dependence and there's a physical dependence on being on diazepam. And so what are the 4 dangers of long-term use of diazepam? Number 1 is tolerance and reduced effectiveness. The truth is that your body when you take a medication for the first time, your body reacts to it. Sometimes you develop side effects of these medications. Some of these side effects, it doesn't mean you're going to have it forever, but your body gradually gets used to it. Also, you can develop reduced effectiveness to those medications. So for instance, if you have been prescribed a low strength of diazepam, say 2 milligram or 5 milligram, you find out that after a few months, taking 1 tablet, for instance, will not be enough, because your body is gradually getting used to this medication. And the danger is that you want more. So if you're on 5 milligram, you want your GP or your doctor or your prescriber to prescribe a little bit more. So you run the danger of needing a higher strength or higher frequency to get the same benefit. And that's number 1 danger. The second danger is what we call psychological dependence. There's a difference between being psychological dependent on a medication or being addicted to it. You see, most people on diazepam, it's not an addiction. It's just that psychologically you feel you need it. When you don't take it, you feel anxious. When you don't take it, you feel, oh, I can't get to sleep, or things, you just can't function, simply because psychologically you have developed dependence to this medication. You feel that you have to always take it. And so that's the second danger you develop when you have had this for a very long time. The third danger is increased road accident. You see, people sometimes, they don't realize if you take a medication that affects your central nervous system or your brain, your reaction time is never the same. You might think you're fine, you might think you're doing well, but the truth is that if push comes to shove, you suddenly realize that you don't react quickly. So if you're the one that operates machineries or you're driving all the time, staying on diazepam, you have to be careful, because that can affect your reaction time. If, for example, you see some danger on the road, it can actually affect you being able to stop suddenly. Those are something to bear in mind also. The 4th and the final thing it does is interaction with other medications like alcohol. So you have to also bear in mind that the danger of being on this is that it's a central nervous system depressant. So you have to be careful. Any other medication like alcohol will affect the diazepam. If you're on diazepam, it will affect how much you can take or how much you can drink. So in fact, ideally, you shouldn't be drinking and also having diazepam. And also, just like some antidepressants, you shouldn't be taking them and taking diazepam. So really, you have to be careful. So if you're prescribed diazepam, before you take it, you need to ask your pharmacist or ask your doctor, explain to them other medication you're on, and ask them whether it is safe to take both of them together. And also, you have to think about how long you want to be on this diazepam. So those are the dangers of having diazepam for a long term. Now, I'm going to go into also how you can stop it, because some people really want to stop, but they don't know how to do it. They don't know how to go about it. Maybe they've been on it for years. It's not a medication you want to stop so suddenly. Really, you need to speak to your GP. You need to have that interaction. You need to go through the phases and do it gradually. My advice is, please never stop your diazepam so suddenly. You need your doctor to talk to you about it. So I'm going to share 4 things or 4 ways you can gradually taper off your diazepam. So 4 ways you can stop it. I'm going to mention number 1 immediately. Now, before I go into 4 ways you can stop it, I'm going to ask, have you subscribed? Please, if you haven't subscribed, I'll be so grateful if you can hit the notification button and subscribe, and also share and like. I'll be so grateful about that. So number 1 is to resolve and willpower. It's not an easy thing to, for example, be on diazepam for a year or 2 or 3 years. You need to have resolve that you're going to stop it. And also you need a bit of willpower to decide, just like in anything else. When people say they want to stop smoking, they have to desire to stop it. I've seen people who have smoked for 10, 15, 20 years, and all of a sudden they wake up one morning and said, I'm not having any of this. It is that desire and that resolve. It's not somebody telling you to do it. It's you deciding that this is the time to stop smoking. And that is where it does the palm. If you resolve and desire that to stop it, it's all about willpower. It's all about you deciding that now I'm going to make a change. Number 2 is to agree with your doctor or your prescriber for a gradual withdrawal. I will say this again, never ever stop your diazepam so suddenly. Your doctor, your prescriber, your GP need to know about it. So have a review, have a discussion. They will decide how you can gradually come off it. Unless they have prescribed you for a few days, that's fair enough. But if you've been taking diazepam for months or years or even weeks, before you desire to stop, please speak to your GP. They will decide how to gradually get you to come off it. Number 3 is you must have a frequent review with your GP. I would say about every 2 weeks. So once you have agreed on deciding to stop, try and have a frequent review with your GP. It could just be a phone call, or it could be a 5 to 3 minutes phone call to ask how you're doing. Do not just do it without having that support with your prescriber. Always seek that support, because they will tell you whether how you're doing. Maybe you have reacted differently. Maybe stopping it or cutting down on the dose have made you feel unnecessary. Maybe you're not sleeping well. Maybe all of a sudden you're coming out in cold sweat, or maybe your heart is beating faster, or maybe those anxieties are coming back. Then that's when you review with your GP or your prescriber and decide, shall we go back up again, or shall you carry on at the rate? So that is why review every 2 weeks or more frequent is good. The 4th and final reason why or how you can stop your diazepam is don't give up. Yeah, keep trying and don't give up. Maybe you have tried to do it. You have tried to stop taking your medication. Maybe you went from taking it every day to alternate day, or you went from taking it 10 milligram to now taking 5, and you just can't handle it. My advice is, when you have spoken to your GP, don't give up. Maybe go back up to 10 again, or to every day, and go on for about a week or 2 and give it a go again. Never give up. This is something you have wanted to do. That's why resolution and willpower, that's why it's very important. Like I said at the beginning, it's something you have decided to do. So my advice is, don't give up and keep trying, because you can actually do it. Thank you for watching. And then if you haven't subscribed, please do subscribe. and see you some other time.